An NHS England survey of student nurses revealed that the most influential factor for them in terms of career choice is the experience that they have on a clinical placement. So now more than ever, practice nurses are an essential part of the practice team with the expansion of the services that are being offered in primary care. They're undertaking a wider range of activities in general practice, in roles that historically they probably haven't before. The key thing that students are looking for in a quality placement is the ability to become part of a team.
In Northamptonshire, we have two particular models that are looking at how we develop different ways of nurse placements. One training hub has increased the number of nurse mentors locally in order to increase the number of placements, while the other training hub has used the capacity of their district nursing team, who already have the mentorship training, to supervise trainee nurses in practices.
There will be opportunities, I think, for particularly practice nurses who will be the mentors and will be supervising these students to then access supervision from within the university and also continuing professional development opportunities that are associated with working with students, so mentorship, supervision, coaching, that type of thing. I think that's also important for the development of the staff generally within general practice.
The nurse mentors are very well supported by our nurse leads, both in the 360 training hub and in the PML training hub. So the nurses have a dedicated point of contact to receive support along the journey to becoming a mentor.
So the majority of the mentors already had a mentorship qualification that they'd gained previously, and they just went through a simple updating process.
For nurses, if they didn't have a mentor qualification, we had courses that they could step onto that would be funded through Learning Beyond registration. General practice is a very unique area, and we've had to look at the individual needs of each practice in how we set up and support the placement. That's been a very team-focused approach. So practice managers, the GPs, the nurses and the advanced nurse practitioners that are in those areas, they've all been on board, and that has given the student the most fantastic experience.
I did the teaching and assessing course a long time ago in 2000. I'd been involved in medical students in long-term conditions projects, but actually in terms of having a nurse student, that didn't start until 2 years ago here in practice. Obviously, I was already a mentor. For me personally, I just needed to attend a 2-hour update at the university, and I was ready to go again. We first had our 2 nursing students in June 2016, and that was a trial, I suppose. They really enjoyed it. They came not knowing what on earth they were going to expect from primary care, having quite a lot of preconceived ideas, quickly realised that there was a massive scope of things to learn from being in practice, to the point where one of those students said, I want to work here in practice.
I spent 2 days at Northampton General on a mentoring course, just basically giving me some guidance on how to support and mentor student nurses that were coming through the surgery, because this was a relatively new experience for us here. When we have a new student arrive, it does initially impact on clinics a little bit, but I don't think to the detriment of any patients. Although I was initially quite apprehensive about it, I do think that it's been good for me, myself, and for the rest of the nursing team. We've had really good feedback from the students that have come through, and some of them have decided to change their career paths.
We get everything provided to us by the uni. A welcome pack comes, they show us how to use their Pebble Pad, they link us up on it, so all we have to do is log on, see what they're doing on it, sign things off for them. It is beneficial because you've got an extra pair of eyes to help you. It's fun really to have somebody working alongside you. It's been good to have a bit more of a responsibility. It's nice to give back to what people gave to me when I was on my placements.
Student nurses come in the treatment rooms with me on my caseload for the day, observing and having hands-on contact as well. That's all been planned into our daily clinic times, so it works really well. And we've had amazing feedback from them, and they've got so much out of it. And for them, it's not something that a lot of them would have even considered coming into, was practice nursing.
Well, I'm not actually a qualified mentor, but I am a coach. Once they've learned a skill, they're actually really good at supporting you. So if we've got a really, really busy clinic, one of the students can be going off, say, doing a dressing, which they've learnt to do, while I see somebody for an injection or a review, a diabetes review, for example. So it's a two-way thing. They can bring their experiences to us, and it's great to see them blossom. That makes it all worthwhile, giving them confidence, giving them reassurance to be able to do the job, yeah.
The feedback from the students has always been really good, and they've actually said we'd love to now to go into practice nursing. It's been really positive throughout the surgery.
Feedback from the students has been outstanding. They have loved it. They have loved being out in general practice.
It was quite a small team, so I got to know the doctors, the nurse practitioners, the nurses, the whole practice, even the practice manager, which I thought was quite nice. You see the same patients regularly, so for wound care, you get the same patients in quite often, which is really nice. You build up a nice rapport with them, whereas obviously in the hospital you don't get that. They're in and out all the time. And I think that's what I like about practice nursing, is that you get to build up that relationship. I learnt a lot while I was there. In one scenario, my mentor sat back a bit and I ran the clinic a bit, which is nice for me, so that I got an overview of what I could potentially do as a job if I qualified there. I would absolutely love to go back to general practice. It's a lot more fast-paced than you think it is.
General practice was my first placement that I had as a student, so I came straight from school. So it's my first exposure to patients and patient care in the NHS, and it was nice to have that one-on-one time with my mentor, the practice nurse. Throughout my training I've contributed a lot, and the more experience I've had and the more confident I've become, my mentor's confidence grew in what my abilities were. I'd undertake things such as injections and taking down leg dressings, and I've had such a positive experience with all my mentors. They've all been lovely and they've all taught me so much, and they've all been outstanding role models. Now in my third year I'm at the point where I'm leading and managing, so I'm taking on my own patients and I'm responsible for their care. General practice is definitely something that I would go towards, and I feel like I've really come out of my shell and it's really made me into the person that I am.
I really want to work in general practice if I can. When I first started as a student, I really thought the hospital is where I want to be until I came out here, and I really love it.
So I think it's breaking the misconceptions of what general practice is really important, and I think hopefully that will attract more nursing students to think of practice nursing as a career option. I think one of the greatest things is when a student turns around and says to you, I never thought of working in general practice, but now this is one of my top things. Let's bring more options to student nurses and hopefully attract them to a career that they wouldn't have otherwise thought of entering.
It's about the future workforce primarily. We need to expose student nurses to GP practices, to primary care, so they actually have an aspiration to go and work there.
I've really enjoyed being a mentor because I've got a real opportunity to shape the future of nursing care.
It builds your confidence because you're mentoring the nurses of the future.
It makes you realise what qualities you've got and what you can pass on to somebody else.
The evaluations that we've received from the student nurses who have been on placement have been extremely positive, which clearly shows that actually they're starting to think that general practice is a good career choice for them, which ultimately is the impact that we're hoping for with this programme.
By increasing the number of placements in practice and allowing people to experience the joys of working in the community, we can encourage them to come and work in this multidisciplinary team that is going to be the future of the workforce for primary care.